I'm in each newscast to talk about mental health. So many people are feeling overburdened, and it is definitely taking a toll.
In fact, the demand for mental health counseling has exploded since the pandemic, and counselors say they just can't meet the need. West 2's Amanda Dukes talked with those on the front lines of the battle about why there is a shortage and what can be done about it.
Here, you take this.
Amy Lewandowski and her daughter see a mental health counselor.
I knew something wasn't right. My behavior, my thinking, my mood.
15-year-old Olivia was also struggling with anxiety, so they sought help.
I felt stuck for a long time, and counseling helped me be unstuck.
Amy and Olivia are fortunate to have gotten established with a mental health counselor before the pandemic because Florida is facing a shortage.
So we've had a wait list for the last 6 months to a year, and it's just difficult to get in and see someone. It's difficult to find.
Mallory Gabriel oversees a local counseling clinic. He's seen a big spike in demand. Shantala Boss has seen the same at her practice in Lake Mary.
When I do have clients come in, they will be very exhausted and will tell me, I've been looking for someone for so long. Nobody will answer the phone.
Counselors say the demand for mental health counseling has been growing for years.
I think there's a general trend of people being okay with saying they're seeing a therapist, and the stigma of that sort of going away.
Add to that the stress of a pandemic.
Because of what we've been going through as a nation, there is a rise in depression with loneliness, and there's a rise in anxiety.
And the third factor contributing to the shortage is the counseling profession can't grow fast enough to keep up with the demand. It can take years for a mental health counselor to get licensed, and some never make it.
And then when they really get into it and they're getting licensed, they're not getting paid. They have super high caseloads. They burn out, and they realize, I'm an educated individual. I can go into something else and make 2-3 times as much money.
Both Gabriel and Boss say increased compensation and respect for the counseling profession would be a start to addressing the shortage. The American Counseling Association is working to ease the stress of burdensome licensure requirements. Currently, a counselor can only treat a patient who resides in the state where the counselor is licensed. To help with the shortage of mental health professionals, lawmakers in 15 states have voted to join a counseling compact. That means counselors in all of the states colored yellow, including Florida, can now practice across state lines.
It's a win-win for everybody. It's a win for counselors to eliminate some of those barriers that keep them from being able to practice, and it's a win for clients, because they can continue to work with a provider.
The ACA says there is also a telehealth provision in the compact that expands opportunities for virtual counseling.
Yep.
Lewandowski considers herself lucky that she is not among the many whose name is on a counselor's wait list.
That's sad for families that need it and that can't get it.
Amanda Dukes reporting, West 2 News.
Now, that counselor shortage is part of the reason why we have the great professionals from the Mental Health Association of Central Florida with us today.
And Meredith McDonough is with some of those mental health counselors right now. And Meredith, how can our viewers get in touch with some of them this morning?
Sheldon, they can give a call right now. That number is 407-830-9374. Give a call. Talk to these amazing health counselors that are joining us this morning. This is just such an important day here at West 2. And joining me now is Marnie Stallman from the Mental Health Association. So Marnie, let's just talk about it. This is such a serious situation right now that so many Americans are facing.
We think mental health is physical health. It's good health. And so we're really excited to be here today to encourage people to call if they're having a problem, if they know a friend or colleague or family member that's suffering and needing some assistance. Our connections team is here to get those calls and get those connections made in the community.
And we're going to be talking all morning long, but if someone does give a call, if they're kind of on the fence, they don't know, if they're uncomfortable doing so, what will your folks say to them this morning?
We're going to try to be really careful. We're not taking a lot of information this morning other than trying to make a connection with the person, make sure that they know what they need and how we can make sure that that gets met for them.
Oh, excellent, Marnie. Well, I'm looking forward to talking to you all morning long. And guys, thanks so much for coming in. So again, that phone number to call is 407-830-9374. We're going to have much more coming up in our next segment. Guys, over to you.
Such an important discussion this morning, and every morning, really. Here's another look at that phone number. Counselors will be taking your calls from now until 6:30 this evening.